Adjusting the strategy.
We all hope that all our objectives are met, but we know from experience that it's not realistic to think that's going to happen all the time.
The value of this type of evaluation is that it allows planners to locate the source of the problem if a program is not achieving its expected results.
If we evaluate our activities and learn that we have not produced a smoking prevention curriculum or have not trained enough teachers to use it, there could be two reasons: a lack of resources or a lack of performance on the part of our personnel. If we determine it's a lack of resources, we have to either find more resources or scale back our expectations. If we determine that it's performance that's lacking, we need to look at our people in terms of their knowledge, skill, and motivation. In other words, we can hire, fire, train, or motivate. The same applies to our process objective. If the smoking prevention curriculum is not reaching the intended number of students, resources or performance may be lacking. Perhaps we need to supply outside personnel to teach the program, or perhaps we could motivate the school principals to make sure the curriculum is covered.
Doing the evaluations as the program proceeds is important because then there's time to make changes.
Once we know that the smoking prevention curriculum is reaching the students, we can begin to measure our impact objective, whether there is a significant increase in adolescents who believe that the tobacco industry is attempting to manipulate them. If we find that fewer than 25% of teenagers believe this, we may have made an invalid assumption. We assumed that if students were exposed to a smoking prevention curriculum, more of them would adopt this belief.
Now the team must re-examine that assumption, revise the intervention strategy, and develop a new work plan.
It would be disappointing, but better to know now. The point is not to carry out our plan exactly as we originally designed it, but to change it until it works. What if our impact objective is met? At least 25% do believe that the tobacco industry uses advertising manipulation. But when we measure our outcome objective, we find that adolescent smoking has not decreased as we had intended. What then? It probably means that the connection between understanding advertising manipulation and choosing to not smoke is not what we assume. Again, we would need to look hard at that relationship, revise our intervention strategy, and develop a new work plan.
Only by evaluating at each phase can we identify what the problem is and adjust the plan accordingly.
As difficult as it is, we all must learn that our plans are meant to be changed.